a home-like setting where all people affected by cancer can go to receive emotional and social support so that no one faces cancer alone. This was the vision of our founders. Their legacy lives on today within Cancer Support Community, Central New Jersey, and it will continue to positively impact the lives of people in our community for years to come. Good evening. My name is Amy Sutton. I'm the Executive Director of this amazing organization, and I'm honored to be with you tonight and our founders, and I have tremendous shoes to fill. These 4 women are justly being honored for their passion, commitment, and leadership. Their efforts are a testament to the power of individuals to change the world, starting in their own community. And they serve to inspire all of us in the belief that anything is possible. So today, we can look back on our journey and feel proud that since we began in 2004 delivering programs, more than 8,000 people affected by cancer have come through our doors to find support, education, and hope. We have grown from a grassroots organization into one that is well organized and backed by national affiliation, ensuring that our work is evidence-based and on the forefront of program development that addresses the essential needs of all people affected by cancer. Nationally, CSC reaches 1 million people a year, delivering $40 million worth of free support into the communities that we serve, including Central New Jersey. And we are the largest employer of oncology licensed mental health professionals in the country. We also have the only National Research and Training Institute dedicated to understanding the psychosocial impact of cancer on the lives of patients, family members, and caregivers. So here in Central New Jersey, more than 1,000 people a year come to us for support. These are not just numbers to us. Each and every day, we see the faces of the people who are affected by cancer and come to learn their personal stories. And it serves as a reminder to all of us who do this work how important this work really is. It motivates us forward to do more, to reach more people until everyone who needs us can find us. And we are no longer the best kept secret, as everybody told me when I started in this position. So this evening, I stand here in front of you, not just as the Executive Director, but I'm also somebody who's been affected by cancer. Before coming to CSC, I watched my father and sister battle this disease, along with so many of my friends and colleagues. I've lost an aunt and an uncle to cancer. And through it all, I always felt incredibly helpless in the face of a loved one's diagnosis. But that was because I had no resources to draw on other than my own desire to want to be supportive to the people I loved. I had never heard of this organization before I became Executive Director in April 2012. The day I started work was the day I found out that my cousin Carla was diagnosed with stage 2 ovarian cancer. But this time, instead of feeling incredibly hopeless, I have an incredible resource to offer, a way to help those I love and myself through the empowering program of support at Cancer Support Community. It is hard to find somebody today who has not been touched by this disease. Those who are affected are not strangers to us. They are our family, friends, and neighbors. And family and friends play an important part in our work as well, because many times they're the ones who call us, or they walk a loved one through the door. And it reminds us the importance of our mission and our connection to community, which was really never clear until Hurricane Sandy hit. So like many people in this room who was affected by that hurricane, in my neighborhood, we were getting ready for that storm. I happened to see a neighbor of mine raking her leaves, so we just stopped to talk quickly for a moment, and the conversation shifted almost immediately away from the hurricane to the fact that she mentioned they had seen me take this job. She saw the announcement in the paper that I had taken this job, and the reason she noticed it was because her husband had just been diagnosed with stage 4 cancer, and her oncologist had just made the referral to our organization. But she had never heard about us. She didn't know anything about Cancer Support Community. She had shared with me on that street how devastating this disease had been on herself and her family, how difficult it was. Made even more difficult for her and her husband was the worry of their children and what would happen to their father. So as she tried very hard to contain all of her emotions, I just reached out and hugged her. And as we stood on that street, she asked me if I could help her. And I told her I could. And I told her Cancer Support Community could. And after I left her, I made a phone call. Because really, all she needed was to trust somebody and to know that somebody was going to do something. And I called Karen Larson that day. And being able to call Karen, who's one of our program coordinators, was such an incredible relief because I did something. And I knew we were going to help this family, and we have. They've been coming to our program, and over time, the whole family's been able to laugh more freely again. They're getting the support they need at a place where people understand what they're going through, and it has transformed their lives. So no matter what the outcome is with this family, we will continue to be there through it all. And the reality is that no one ever needs to face this disease alone. All of my experiences with cancer have made me more committed in my resolve that we need to expand awareness and reach of our organization. So I'm going to share with you my dream. And it's a little long, so, but it's mine and it's the organization's, and I hope it becomes the community's. I'd like to see us double the number of people we reach each year by being able to expand our physical and virtual footprint and increasing the number of volunteers, staff, outreach resources, and licensed mental health professionals to be able to carry out our work moving forward. I'd like to be able to reach more broadly into the community to include underserved populations and young adults, to find ways to continue to share our expertise in order to improve the lives of all people affected by cancer and contribute back to our partners through initiatives like our nationally recognized distress screening program. I want to continue our program at no cost. It is at no cost to the individuals who come to us. So there are no barriers to access other than the fact that they don't know we're here. In order to do this, we will expand our major gifts fundraising efforts, and we will develop corporate partnerships in a way that will provide us with sustainable revenue so that we can cover our expenses, because there's a cost to these programs. And most importantly of all, we're going to be seeking out angel investors. Some of them might be in this room tonight. And these are individuals who can invest in our growth at a significant level, because the bottom line impact of cancer and distress is significant in affecting people's lives, within businesses, and throughout the broader community. These funds will be critical to ensuring our growth and essential to be able to reach our goals. So for me, my dream is that I never hear again that we're the best kept secret. My dream is that Cancer Support Community is a name known in households across our community as the best place for people to go for support so they never face cancer alone. So I want to thank you all again for coming this evening and for being part of our journey these last 10 years and hopefully joining us on the next phase of our journey. Thank you.